I waste is water in the shower.
I waste plastic containers, plastic bags that fruit and vegetables come in.
I don't squeeze all the toothpaste out the toothpaste before I throw it away, and I know I should.
I've done my share of wasting electricity. Who has all these lights on?
In this country, we waste a lot of the resources that we have in medical care. Many studies have now come up with the same figure. 1/3 of what we spend on health care is probably not necessary and therefore wasted. It is huge. It is a profound problem. Choosing Wisely is a wonderful way to address this problem of waste in the healthcare system because it brings together the people who ought to be talking about this, the doctors and the patients. We asked each specialty group to come up with a list of 5 things where there's evidence of overuse and waste, and then to disseminate that information to their own members. Some good examples are things like chest x-rays for people who don't have any symptoms, or EKGs before minor surgery, CT scans of the head for uncomplicated headache, and in the treatment section, antibiotics for sinusitis. One of the reasons why consumers need to be aware of this overuse of medical treatments and tests is because they often are risky. Every time you take a medication, there's some risk of a side effect with that. Every time you have an x-ray or some other kind of diagnostic procedure, there are usually small but still real risks that go along with that. So patients need to be aware of that, and particularly if it's not necessary and if it's not going to help you, be able to ask their doctor, do I really need this, and is it worth the risk? The ABIM Foundation then realized that what we could do is partner with consumer groups to get the word out.
Consumer Reports for decades has been providing information to consumers based on actual research. In the case of Choosing Wisely, what Consumer Reports is doing is taking information based on solid research and evidence, providing it to consumers in easy to understand plain language, and then what we're doing is putting it on a website, consumerhealthchoices.org. And really what we're encouraging patients to do is to say, ask questions, ask about the benefits, ask about the risks, ask about the alternatives.
What this is really about is physicians and patients having a conversation, but it turns out the doctors really are saying that they want the patient to do that, and they want to be able to have that conversation.